Hey guys, in this video we're going to be talking about truth-telling and confidentiality. So here are the broad issues that we're going to talk about in this lecture video. The first is the question of should healthcare professionals always tell the truth and fully inform their patients? And as we're going to see, there is a difference between not telling the truth or just lying and not fully informing. So those two things can come apart. Now, if not, under what circumstances should a healthcare professional not fully inform or not tell the truth? And I'll say right now that those circumstances are far and few between. And what moral principles are at stake in guiding our judgments in these kinds of cases? Another broad issue is it ever permissible or even obligatory for the healthcare professional to disclose health information about their patients in other words, to make healthcare information public about their patients? In other words, is it ever permissible for healthcare professionals to break patient confidentiality? And as we'll see, there are a few cases in which this is morally permissible. So let's talk about truth-telling. Up until recently in history, up until sort of the rise of medical ethics and bioethics, truth-telling was viewed as subservient to beneficence in the medical field. So medicine, as we've seen, used to be much more paternalistic, and misinforming, misleading, and straight up lying to patients was seen as not so bad, just so long as it was judged that that was to the benefit of the patient. So not telling patients the truth about a diagnosis or a prognosis, or not fully disclosing the relevant information, it was more commonly justified on grounds that this would harm patients. But today this kind of paternalism is less common, and professional standards encourage truth-telling. So truth-telling is much more common today than it used to be, and it's a very important professional standard. So let's take a look at the difference between truth-telling and full disclosure of information. So sometimes a healthcare professional may violate the principle of autonomy even though she tells the truth. So you can tell the truth to a patient and nevertheless not respect the patient and undermine that patient's autonomy because the healthcare professional is not revealing important information. So not lying is not enough to respect patient autonomy. Full disclosure of relevant information is also important. Now, it's up for debate what information the patient needs to know, what information is relevant, depending on the case. And a lot of papers are written about this, but usually information that needs to be disclosed is information that the patient needs in order to make a good judgment about what is in their interest and what decision best aligns with their values. So withholding relevant and important information about a diagnosis or prognosis, doing this disrespects the autonomy of the patient because it may mislead the patient and prevent them from making informed choices, particularly informed choices that are based on their conception of what makes life go well, based off of their own values and interests. So take a look in your book at page 144 and take a look at that case, and it'll show you an example of a physician that withholds information from a patient because he believes it's in that patient's best interest. So take a look at that to see an example. So in this case, the doctor doesn't lie to the patient, but nevertheless still misleads the patient, maybe even deceives the patient by not giving her all the information that is relevant to her diagnosis. And in this particular case, most bioethicists would say that the physician did something wrong, definitely. Okay, so we can look at an argument for not fully disclosing or not telling the truth. And we can call this the argument from beneficence. And then we'll take a look at how good this argument is. So the first premise is that healthcare professionals should always follow the principle of beneficence. In other words, they should ensure the well-being of and heal the patient. So this seems pretty uncontroversial. Second premise, in certain cases, call those cases C, truth-telling can injure the patient, thereby undermining the patient's well-being and ability to heal. So, in these kinds of cases, telling the truth, it can injure the patient by, say, for example, causing stress, which we know lowers the immune system. It can cause feelings of hopelessness, panic, fear, extreme anxiety, and negativity, and this can undermine the patient's uh, ability to heal and get better, and so it would go against the principle of beneficence. So it follows from these two premises that healthcare professionals should not tell the truth or fully disclose in certain cases specified by premise 2. Okay, so looks like a pretty good argument at first, but let's take a look at some objections against that argument. So the first series of objections actually are going by the same principle that the argument is going by, which is the principle of beneficence. So the first objection is that premise 2 exaggerates the harm that can be done to the patients. And recall, premise 2 is that in certain cases, telling the truth or fully disclosing could harm the patients. So this objection is saying, well, that premise, it goes too far. It exaggerates the harm that's done to the patients if you tell the truth or fully disclose. Furthermore, we should note that the way in which you tell the truth can matter. And if you tell the truth and fully disclose and you lay it on the patient in a cold, blunt way, that could cause a lot of anxiety. But there's other ways of communicating that information that can put it in a sort of a softer manner that may prevent the patient from being harmed. Objection number 2, informed patients are better patients, so they will be more likely to heal. So this objection is basically saying, if we're going by the principle of beneficence, we should fully inform the patients, and that will give them the ability to make good choices based off of full information and based off of their values so that they can choose a good option. All right, my dog wants attention, so I might have to pause this in a minute. Objection number 3, deception breeds mistrust between the patient and healthcare professional relationship. So if we find out, if people start seeing that it's common for healthcare professionals to deceive, mislead, or lie to patients, this is ultimately going to harm patients because it's going to disrupt the patient-healthcare professional relationship. And that ultimately goes against the principle of beneficence. You don't want to disrupt that relationship. It may lead patients to not trust their physicians, and that will have really bad outcomes. So the fourth objection appeals not to the principle of beneficence, but rather to the value of autonomy, or the principle of autonomy. And it basically says that lying and not disclosing relevant information, this fails to respect the patient's autonomy. And it does this by constraining her ability to make informed choices. In order for the patient to make informed choices, and so respecting the patient, you need to give the patient full information. Okay, so what are some cases in which lying may be permissible? So there may be some cases in which lying or not fully disclosing could be permissible. Now these are very much up for debate. There aren't many cases, and again, I stress that it's against professional standards to lie to patients or to misinform them or not fully inform them. But perhaps in certain cases there are exceptions. Perhaps lying is permissible only when the deception is minor and the benefit to the patient is great. So here we're getting a little bit speculative and getting to very controversial grounds. But one example could be something like this. Imagine that a child is flying in an airplane with his parents. The plane crashes. He is the only survivor. The child is in critical condition and asks the healthcare professional if his parents are okay. Is it okay in this case to lie to the child and say, yes, your parents are okay? Some people in class, when I talk about this, say that it would be okay. In fact, the healthcare professional should lie to the child because if you tell the child the truth, that's going to devastate the child, and that's going to prevent the child from getting better because, after all, the child is in critical condition. Others argue that no, you should tell the child the truth, because otherwise, um, when the child finds out he was lied to, it's going to be traumatic, and the child may not trust healthcare professionals. So this is an interesting and controversial case of when it may be permissible to lie to a patient, but it is up for debate. One thing to consider about this case is we are talking about a child who is not fully autonomous, and so the principle of autonomy may not apply or may not fully apply. Okay, let's talk about healthcare professionals and patient confidentiality. Um, are there consequentialist arguments for confidentiality, of not revealing information about the patient to the public? So we looked at consequentialist arguments of lying or not fully disclosing. Well, are there consequentialist arguments for maintaining confidentiality? Now, note that common arguments for maintaining patient confidentiality usually involve respecting the patient's autonomy, which is a non-consequentialist argument. But there are consequentialist arguments for maintaining patient confidentiality. One is that if patients don't trust physicians to keep information confidential, then the patients will be less likely to tell the truth about their symptoms to the healthcare professional, and that's going to obviously have some bad results. It'll make it more difficult to treat the patient. It will also be harmful to the whole practice of medicine and the institution of medicine if patients stop trusting healthcare professionals. Okay, are there bad consequences that could result from revealing medical information about patients? And there could be bad results. So it could subject the patients to discrimination from insurance companies, the workplace, and society. It could disrupt personal relationships. It could subject them to public ridicule or shame. So, for example, if a patient is diagnosed with HIV, if that information is revealed to the public, then that could result in discrimination against them. If the patient is diagnosed with a mental illness and that's revealed, then that information could be used against the patient because some mental illnesses are stigmatized. So there are good consequentialist arguments for maintaining patient confidentiality. Now there are also some non-consequentialist arguments for confidentiality. So I'm going to pause it here, and then we're going to take that up in the next video.